Hello and welcome to Ostomy 101. My name is Donnette and I have an ostomy. I'm here with Star Harrison. She is a wound, ostomy, and continence nurse. And we're going to talk about today 3 accessories: rings, paste, and tape. But first of all, you have something to say about accessories, right?
Yes, I'm always encouraging my patient to always ask themselves, why are you using the accessories? If you need it, use it. But if you don't need it, don't use it. The less, the better
So
is the
let's
goal.
keep it simple.
Keep it simple.
Keep it simple. All right. So the first thing that we're going to talk about are rings. And this is an example of some of the rings. And pretty much every manufacturer will send you a free sample so that you can decide what works best for you. But what are the indications, Star, that we should maybe consider using a ring?
Okay, if you're having a lot of leakage issue and you feel that you're changing your pouch system so frequently, you may have some kind of skin irregularity around the stoma that may be causing the leakage. And that's when a ring can really play a big role. It fills in all the uneven spots around your stoma, or a scar tissue, or a divot, or a skin fold. And that can really play a big role, and it will help to enhance your seal or give you a flat surface.
So flat surface, so it's almost like caulking, right?
Yes.
If you have some of those divots or waves, it creates that flat surface and you can get a better seal sometimes.
Correct.
Right?
Right.
Okay.
Now, if you're not getting that good seal on using the ring, then that's when you might consider using the paste, because the paste can fill in those tiny little divot that perhaps the barrier ring will not be able to fill in. So that's, you have to always ask yourself, if you're still leaking with just the use of ring, you may need an extra help. And that could be the paste.
Comes in like a tube,
yes,
right? Almost like a toothpaste tube, and you can squeeze it out.
Yeah.
And I know one of the things that you wanted to say about this is a ring, but they also, this same kind of thing also comes in a strip.
Yes.
Right, that straight strip. And so when would you use a straight strip as opposed to a ring?
Okay, I would use the strip if you are still leaking and like in one side, let's say at 3 o'clock, and yet you're already using a ring. So that 3 o'clock divot may need half of the strips in order to fill in that area, so prevent any leakage. And this could also be used for like fistula or any other area that's still causing a lot of leakage because you're still not completely filling in those gaps, and that will fill in that area by using a strip. And now you do need to have some good dexterity in order to mold and, you know, be able to cut that into half and be able to fill in that uneven area. So if you don't have that type of dexterity, then I would stick with the ring, and you can even cut that into half instead of molding a strip.
And this goes right around your stoma.
Yes.
Correct?
Or in the area of uneven skin.
Okay. Now there's one other indication that you wanted to mention about using paste and rings, and that's having to do with convexity, creating a soft convexity, right?
Yes, yes.
And this is for people who have a stoma that is flushed with their skin or recessed. So tell us how that works.
So how I would really encourage is to go ahead and call a manufacturer for a sample of a convexity so that you can address that. But for the meantime, while you're waiting for that sample, you can go ahead and create your soft convexity out of a ring by building it up in the back of your skin barrier and make that convexity. And so that's another indication of using the ring.
It's kind of MacGyvering your own pouching system,
right? So that you can actually be able to address your leakage issue until you get your convexity. So this is really good for post-operatively because you do not want to use a very hard convex. So the skin barrier ring is soft enough that you can build it up to a convexity without harming your skin between the skin and the stoma.
All right. So if you have a flush stoma or a recessed stoma, this could be an answer for you.
Right, for an immediate answer. But your total answer would be getting a sample of a soft convexity.
Fantastic.
Skin barrier.
So another thing that we can talk about to enhance the seal are what's called barrier tapes or extended barrier tapes. And how they work is that you put them around the edge of your barrier. So when would you use this? What would you use this for?
So the indication of that would be when you have leakage issue, despite of all the rings that we talked about and the paste, and you're just wanting to have a better wear time of your pouch. So this extend that time. And
Hence the name extended.
Yeah, that's why it's called extended barrier, because it does gives you an enhancement to that you can have your pouch system a little bit longer. There's different types, right?
You can get them like this that go all the way around, or strips, or straight, or shorter, or thicker. So there's lots of different kinds. And most manufacturers will send you a sample so that you can try to see which ones work better for you. And some are even made out of silicone so that they're really, really stretchy and very comfortable. I notice in the summertime, sometimes just because I sweat a little bit or I'm exercising, that the edges of my barrier here start to peel a little bit. Maybe it's not time for me to be changing my whole system out, but it just starts to peel. So I use those barrier strips right along here just to extend my wear time.
Yes.
The final thing that we're going to talk about is powder. So you really should be addressing any leakage that you might have. And in addressing that, you might need to use some Stoma adhesive powder. So be sure and watch our video on crusting, right?
Yes. And just keep in mind that those powder is to absorb any moist from the skin breakdown, the moisture that is pretty much what you see on those skin breakdown or skin irritation around your stoma. And if you're not addressing that, you will continue to have leakage. So make sure that you look up our crusting technique video so that you would be able to really address the skin breakdown and the leakage issue.
And help heal your skin.
Yes.
You can find some of these accessories under free samples, so you can order free samples from there, or you can also look up under accessories, tapes, rings, and barriers.